Hello, my name's Julie Hebert. I'm here to go over your employee benefits through Tech Quip. This is for the year beginning July 1st, 2026. So there are a few changes. So if I can have your attention for a few minutes, hopefully you can learn a little bit more about your benefits and maybe I can answer some questions for you. In 2026, TechQuip will continue to offer medical coverage through Aetna. This year, there's going to be three plans. Previously, there were two, so there's a new addition here to know about. And we're going to move the voluntary life, disability, dental, and vision to Pacific Life. And so this will be a new carrier for you there. So, as I mentioned, there'll be three plans with the medical through Aetna, then the dental, vision, long-term disability, and life insurance will move to Pacific Life Insurance. So, the life insurance, there's basically three different plans. So, let's just talk briefly about each of these plans. Plan number one is a PPO plan through the Choice Plus 2 network. This is the largest network that Aetna has. It's going to have the most options for you. If you are not in Texas, this is definitely the plan that you should consider. You will have some coverage issues with Plan 2 and 3 if you are not living in Texas or one of your dependents is not living in Texas. So that's one important thing to know there. If you do need to go out of network on this plan, you will have an out of network coverage. It is a full PPO. You do not have to have any kind of primary care physician. There's no referral process. It is accepted outside of Texas. So this is kind of the highest level plan. Plan number two is a mirror plan of plan number one, but it is the Aetna Select Network, which is a little bit smaller. It's an EPO plan, which says that if you go outside of the Aetna Select Network, you will not have benefits unless it's an emergency. If you live in Texas, I think this is going to be fine for you. If you're in the Houston area, you'll have plenty of access to doctors. If you are traveling and have an emergency, you'll have coverage, but you're going to have trouble with this one if you're living outside of Texas. So both of those plans are very similar. We'll talk about the details of those two. Plan number three is also an EPO plan, but it is a high deductible plan. This is a new option that's available to you this year, and we'll talk about that option. So let's just focus right now on plan number one and number two. As I mentioned, the biggest difference between one and two is the network, whether or not you can go outside of the network and whether or not you can live inside or outside of Texas. Neither of these plans require a primary care physician. This is an important thing to note here about whether or not you live in Texas. These both have the same calendar year deductible, so it's $2,000 per person and $4,000 for the entire family. Once you've spent that $2,000 per person, then you have co-insurance where Aetna will pay at 80% and you're going to pay at 20%. The most you're going to pay out of pocket, and this is if you've gone in the hospital, had a surgery, some kind of major medication that you take, you could at most spend $6,000 per person, $12,000 for the family. So if you have four people covered and the first two people hit $12,000, the second two folks are covered at 100%. Your primary copay is the same on plan one and plan two. You have a $25 copay to go see your general doctors. If you go see a specialist like a cardiologist, a dermatologist, any kind of ologist type doctor, it's going to be a $75 copay on both the plans. If you're in the hospital, you're going to meet that $2,000 deductible, then the insurance is going to pay at 80%, you're going to pay 20%. That also applies if you have an outpatient diagnostic x-ray and lab services. It's going to all be subject to that $2,000 deductible. If you go to an urgent care, it's a $75 copay. So this is a great option to consider. I encourage you to find an urgent care that's close to where you work and where you live and know where that is because if you're on a weekend at nighttime and you're not feeling well or you have some kind of small emergency, if you can go to an urgent care and get that taken care of, it's going to be a lot less expensive than visiting an emergency room. Everything with wellness is covered at 100%. So that's a very nice thing on all three plans covered. So you get your wellness exam, you get x-rays done if it's part of a wellness check, mammogram if it's part of a wellness and not a diagnostic procedure. All those things are going to be covered at 100% on all three plans. If you do have to visit the emergency room on plan one or plan two, you're going to have a $300 copay, and then they're going to be subject to your deductible and your co-insurance up to your maximum out of pocket. We encourage you to only use an emergency room in a true emergency. Otherwise, try to use an urgent care when you can, just because that cost difference is pretty dramatic there. If you do have to have any kind of diagnostic imaging done, like a PET scan, a CAT scan, an MRI, you are going to be required to get prior authorization. You're going to be subject to that $2,000 deductible, and then you're going to pay at 20%. Plan one and two have prescription copay plans, and it depends on the tier of drug, tier one, two, three, four. So this is going to be generic, non-preferred generic drug, brand name drug, non-preferred brand name drug, then specialty medications. So those are your copays there for those items. Plan number three is a high deductible health plan. This is a plan that you could also start an HSA at your personal bank, and you could fund the amounts that you need in your high deductible health plan through an HSA account. You would get a tax return form at the end of the year, and you'd be able to exclude the amount you put in that health retirement account, health savings account off of your income taxes. So on the plan like this, your first $4,500 are going to be spent completely on your own. So you're going to go to the doctor, you're going to give them your card. They're going to tell you what the negotiated rate that Aetna would charge, say for a doctor's visit, a prescription, anything that you have done. Then you're going to pay that. And as you incur costs, that's going to go towards that $4,500 deductible. Then once you've met that 4,500, everything's covered at 100%. So it's a good plan if you're not sick very often, it's a little bit less expensive, or maybe you do take some really expensive medication and you know that you can reach that $4,500 pretty quickly, then everything's going to be covered and you have nothing to worry about. These are your semi-monthly premiums. You can see you're paying a premium to be on the PPO plan with the freedom of choice, a little bit less for the EPO plan, and even less for the high deductible health plan. This is talking about how to register on the My Aetna website. That's very important. You can get a temporary ID card. You can find providers. There's virtual care there. There's a lot of information through the Aetna website and the Aetna app. This is talking about the health savings account, which you can only use that when you're on plan three. If you're on plan three, that's a high deductible health plan. You can go to your bank and say, I want to open an HSA account. You could fund up to $4,400 per person in that HSA so that then when you need to have expenses to pay, you'll have that money there in the HSA account and it'll be ready to pay your copay or your out-of-pocket cost. The dental insurance is moving to Pacific Life. So the coverage there is good. I think you're going to enjoy it. This is how to find a provider to go to the Pacific Life website. Preventative care is covered at 100%. Basic care, meaning like fillings, things like that, are covered at 80%. Major care is going to be like crowns and dentures are going to be covered at 50%. And orthodontic care is covered at 50%. There is a once a year $50 deductible. You don't have to pay that for preventative care, so you can go get your teeth cleaned twice a year, get basic x-rays done, and that's all going to be covered at 100%. If you have a little filling, then you would have this $50 once a year deductible. You do have an annual limit of $1,500 in benefit, and you have a lifetime limit of $1,500 for orthodontia, and this is only for children under 26. So here is the payroll deduction for the dental premium. The vision is also moving to Pacific Life. They do have a nice network with iMed Network, which is a lot of great providers are in the iMed network. And then they also have what they call plus providers. So if you use a plus provider, you will get like things like the exam is free. You don't have the $10 copay. You'll have less out-of-pocket costs if you use an in-network plus provider, which you can see that when you go and look for the providers on the Pacific Life website. You'll be able to see which ones are preferred providers. They have a little symbol next to them and they're in purple, I believe. So you'll be able to see that. These dollar amounts are assuming that you don't necessarily go to an plus provider, but if you do that, it's even less than these amounts. So the eye exam is $10. You can go and get your eyes checked every year. Your frames are $150 frame allowance, and 20% off of any amount over that. You can get new frames every other year, new lenses every year, and you can get your eyes checked every year. Excuse me. excuse me. The corrective lenses, you can have a $25 lens copay cost of $25. That basically covers all your lenses. If you start getting things like transitions and certain coatings, those are going to be additional charge, but you can get a basic pair of glasses with new lenses for $25, $150 towards the frame, and then 20% off of anything over that. If you want to get contacts instead, they give you $150 towards contacts, and it's either contacts or glasses, not both in the same year. So here's the premiums for the vision. The long-term disability is also going to move to Pacific Life. This benefit's covered completely by Quip. It's 60% of your salary up to $6,000 per month after you've had a 90-day period of not being able to work. So this is a really nice benefit. If you're hurt, if you're sick and you're not able to work for 90 days, you would receive a stream of income that's provided by Quip. They also provide a $25,000 life insurance policy. It is reduced based on your age, 35% at 65 and 50% at 70. TechQuip again pays 100% of this cost, so I want to make sure we have a good beneficiary on file for you and keep that information up to date. You can also purchase additional life insurance on yourself and your spouse and your children. There's more information out there in the ease tool about that. This is your time to make changes. If you want to add, drop, change your coverage, this is your time to do so. You have until July 1st when these changes will go into effect. If after that, something would have to happen, like a life event, to have a qualifying event to make changes. Like if you got married, if someone died, if you got a divorce, if you have another child, things that happen that are kind of out of our control, are not necessarily normal events, things like that can be covered as a life event. And you just have 30 days to let us know, and we will get those changes made. This talks about how your Medicare, if you're over 65, works with the plan. And this is talking about if you're a new employee, you have 30 days to get enrolled. This is talking about Cobra, and if you are under Cobra and you wanted to continue the premiums after you left TechQuip, it would be this much per month. So you can tell they're giving you quite a nice support there on that. Here's my contact information if I can ever be of assistance. I'm always here to help. We appreciate you guys, and reach out if I can ever help with the insurance problem or if you have a question. Thanks so much.